Hi, welcome back. It's Dr. Sean Peterson here in Sarnia, Ontario. This talk is entitled, Why Can't I See My Family Doctor? And it's a question I hear from many of my friends and patients and colleagues all the time. And even from my members of parliament saying, hey, Dr. Peterson, why can't patients get in to see you? So I want to dig into some of those issues that we're facing and try to explain the landscape that we're looking at. In Canada, we're ranked number 32 out of 35 countries for number of physicians per population out of developed countries. So right off the bat, we have a drastically low number of family physicians, and actually physicians in general. When we look specifically at Sarnia, and I would say this is true for the rural areas of Ontario outside of Toronto and Ottawa, we actually see that the density of physicians there is 1/3 what it might be in Toronto. So that means for docs like myself in Sarnia, there are not many of us for our population. And we're doing everything we can to provide family medicine care or primary care to the entire population of Lambton County. As such, we look back in medicine 50 years ago, when the patient would come in, sit down, chat with the doctor, and go out, we don't have enough physician hours in the day to have that type of interaction anymore. That degree of personal connection is unfortunately just not doable with our current economics. Furthermore, all of us as a population, we're all aging. We're all getting older, and through general life improvement, through general medical improvement, we're all living longer. So generally speaking, my practice of patients is older and sicker than it would have been 10 years ago and sicker than it would have been 20 years ago, which means I'm spending a lot of my time working with some pretty sick patients. For simple issues or common quick problems, I don't have capacity, and nor does any other physician, to address all those issues in the healthcare system. As such, we've had to come up with those solutions, and this is where we become creative. And the model I have in my office is a model that's starting to be adopted across the province, and it's called team-based care. The idea here is, well, not every problem needs a doctor, but definitely every patient does. And the concept here is, for things that are more straightforward, well, my team can help you sort that out, and it's in consultation with me. I'm aware of what's going on, reviewing cases, and oftentimes providing the direct communication to my nursing staff to provide that communication to you. What that does, that frees me up for the more complicated cases. So unfortunately, if you were to come in and you have heart failure, and you have a new cancer diagnosis, you have a new mass, and we need to sort out what's going on, you're in terrible pain, you're having advanced dementia, not coping at home, that's where my skills are best suited, so I can help you sort through those things. And by having my team look after the other issues that are more straightforward, it allows me to be available for my patients in that sense. The other thing we're doing in my office, which we're seeing in other offices, is something called telephone triage. So in the past, you'd call in and say, hey, can I get an appointment? My secretary would say, yes, we can book you in. It's gonna be 4 weeks. You would say 4 weeks, that's way too long. There'd be a negotiation back and forth, and eventually we'd probably get you booked in maybe 2 weeks' time, and the schedule would just be crazy because we've done that with every patient. Fast forward to today. What we do now, when you call in and ask for an appointment, we actually start the appointment on the phone. One of my nurses calls you back and goes through all the questions about what's going on, gains information from you about to better describe what is challenging at this point. My nurses then take all of these calls, and on Mondays and Tuesdays, sometimes it's 80 phone calls, and the nurses present the cases to myself or one of my nurse practitioners, and we go through it and we provide triaging instructions. And it might be something as simple as, yes, tell the patient they can do what they're asking. That all sounds good. It might be, let's increase that medication. Could you please let the patient know and report back if it's not working? It might be, I'm going to call that patient. Let them know I'll call them today or tomorrow. In some cases, it's, that sounds pretty serious. Can you have the patient come in today? So by doing this telephone triage, I've changed things around such that not everyone's coming into the office, which makes things much more efficient for you as a patient because you're not having to take half a day off work to come see me. And number two, it makes it more efficient from my end because I now have capacity in the office to bring in the patients that really need to have physical exams or have urgent medical issues. This new model we've had in place for about 1.5 years now, and it actually makes for a much more enjoyable environment for us to practice because I know I can be available for you and my team can be available for you, and we're trying to address, trying to match that care exactly to the problems that you have going on. I ask that you stick around because in 2023, we're going to be making additional changes that will make life even more efficient in terms of providing care. Ideas here, we're looking at doing online triaging so you can provide information via the online portal. We're looking at creating a whole bunch of videos just like this to help provide information to the patients. And we're also looking at having some small group sessions so we can do some learning in a one-to-many relationship as opposed to that one-to-one relationship. The idea here is I want to change how we do knowledge translation, how we get knowledge from here out to you guys. And the idea of coming to the office and having a discussion with me works well for a problem, but it doesn't give us much time to do a broader discussion about a disease topic. As you can imagine, I have many patients with similar diagnoses. So what I'm hoping to do in the coming videos is set up individual talks around different disease conditions. For example, diabetes. My plan there is to invite everyone in the practice to listen in on our talks on diabetes. And I'll pick off different topics as we go through the different weeks. One might be, well, what is diabetes? Why did I get diabetes? Another topic might be, well, hey, I've heard about Ozempic, this new injectable. Is it right for me? So I want to have these different types of talks online so that when you come to see me or you're talking to me on the phone, you've already got some additional knowledge, and then therefore your questions you're asking will be deeper questions. It's going to expand your knowledge and ultimately improve your healthcare as well. So with all this, I'd like to say thank you for your patience. Thank you for your understanding as we transition. This change we're seeing in my office is not unique to my office. We're going to be seeing similar changes all across the province as our province struggles to provide primary care in really what I call a scarcity of resources. We don't have enough family physicians, we don't have enough specialists, we don't have enough hospital beds, we don't have enough imaging facilities. So we're trying to do the best we can, and we need to be innovative in how we provide that care so that you really live the best and healthiest life. So I thank you for your time, and we'll talk soon. Thanks.